Hello and welcome to a discussion on the bony pelvis. So the word pelvis simply translates to the wet basin, and the bony pelvis is going to be made up of 4 bones. You're going to have the sacrum, you have the coccyx, then you have 2 innominate bones on either side, which are going to be the hip bones. Right. Function-wise, the pelvis will support the pelvic viscera. It will also support the female organs during parturition, and it also provides attachment for muscles as well as support during walking, right? And these 4 bones, they're going to be fused by ligaments as well as joints. In particular, this is going to be the symphysis pubis or the pubic symphysis, right? The symphysis pubis is a secondary cartilaginous joint, which is going to be a joint between the bodies of the 2 pubic bones in this case. And this is going to be covered by hyaline cartilage, right? Then you're also going to have the sacroiliac joints in this region. These are going to be the sacroiliac joints, which are plain synovial joints, right? Which are going to be formed by the auricular surface of the sacrum, as well as the auricular surface of the ilium, right? And these are going to be surrounded by ligaments. There is a ventral and a dorsal sacroiliac ligament. Then you also expect to find the interosseous sacroiliac ligament plus an iliolumbar ligament for this sacroiliac joint. Right. If you look at those ligaments, if you look at the interosseous sacroiliac ligament in particular, it's going to be the second strongest ligament in the body. Right. Then you have a ventral, then you have a dorsal. Right. Then the iliolumbar ligament will simply connect the transverse process of L5 vertebra to the ilium. Right. But remember, the sacroiliac one, the intermediate one, or the interosseous, if you may call it, sacroiliac ligament, is actually going to be the second strongest ligament within the body. Right. Then you also find other particular ligaments, which are going to be, you're going to have the sacrotuberous. Then you also expect to find the sacrospinous ligaments. The sacrotuberous and the sacrospinous ligament, they're both going to be strong and they're triangular in shape. And the names are going to be self-explanatory, right? So you're going to have the sacrospinous joining the sacrum to the ischial spine on the ischium, which is going to be this one. Then you also have sacrotuberous joining the sacrum to the ischial tuberosity, right? Then you also have a joint in this region. This is going to be the sacrococcygeal joint, right? This is a secondary cartilaginous joint, and it's strengthened by ventral and dorsal sacrococcygeal ligaments, right? Then if you then look at the bones themselves, there's going to be the bones that are on the posterior surface, which are going to actually be part of the vertebral column, right? For instance, this is going to be the sacrum. Then this is going to be the coccyx, right? And if you look at the sacrum, those are the 5 fused vertebrae that I mentioned, and it's going to actually be wedge-shaped, right? Or you can actually use the word triangular, right? So it's wedge-shaped or triangular in shape, right? And in an anatomical position, you'd find that the sacrum, its pelvic surface, which is going to be the anterior surface rather of the sacrum, it's going to be directed downwards and forwards, right? Whereas the dorsal surface, which I'll show in the next slide, is going to be directed in the opposite direction to that of the ventral surface, right? So it's actually going to face upward and backward, as opposed to this ventral surface, which we said it's going to face downwards and forward. right? And the upper surface of the body of the first sacral vertebra here, it actually slopes forward at an angle of about 30 degrees, right? Then there's what is known as the lumbosacral angle, right? Whereby the articulation between S1 vertebra and the fifth lumbar vertebra is going to be at an angle of about 210 degrees, right? And if you remember from your posterior abdominal wall, when you mentioned the lumbar vertebra, there was something that was going to be called sacralization. Sacralization of the fifth lumbar vertebra is when the fifth lumbar vertebra becomes fused or actually joins the first sacral vertebra, and they act as one vertebra, right? And then there's something called spondylolisthesis. Spondylolisthesis is the forward slipping of the fifth lumbar vertebra over the sacrum, right? That's spondylolisthesis, different from spondylosis, right? Then generally, the sacrum will have a base, which is at a higher level as compared to the apex. Then the surfaces, you're going to have the pelvic surface and the dorsal surface, which I'm going to focus mainly on. Then, of course, you have the lateral surfaces, which I won't dwell much on, right? Then the upper surface of the body of the first sacral vertebra is going to articulate with the fifth lumbar vertebra, right? And just behind this first vertebra, you expect to find the sacral, the vertebral foramen rather, which leads into the sacral canal, right? Then you also have pedicles, then you have lamina. The pedicles are going to be short, and the lamina, they're going to be directed obliquely. I'll show you on a picture that only focuses on the sacral vertebra, right? Then the transverse processes are going to be massive and fused with the corresponding transverse elements of the lower sacral vertebra, right? Then you also expect to find spinous processes. You also expect to find spinous processes if you look at the posterior view. So those are going to be your spinous processes, right? And the spinous processes form the first spinous tubercle, right? Then those are the superior articular facets, right? And if you look at them, they actually project upward, right? Then this is the region where you have the apex, right? Then this is the dorsal surface of the pelvic sacrum, right? So that's going to be our dorsal surface, right? Then the fourth and the fifth sacral vertebra may fail to fuse in the midline, forming what is known as a sacral hiatus here, right? So that's the sacral hiatus. And just like we mentioned, sacralization of the fifth lumbar vertebra, you may have lumbarization of the first sacral vertebra, right? Then if you look at the pelvic surface again, this is going to be the pelvic surface, and you see anterior sacral foramina, and on the back you also see posterior sacral foramina. The anterior sacral foramina will allow passage of the ventral rami of your upper four sacral nerves, these anterior sacral foramina, right? Then the dorsal ones will permit passage of the dorsal rami of your sacral nerves, right? Then that's the coccyx. The coccyx is also known as the tailbone, and it's also going to be wedge-shaped or triangular, where you have four fused coccygeal vertebra, right? And the tip of the coccyx lies at the level of the upper border of your pubic symphysis, as you can see from this picture here, right? Then it's also going to have a base, it is an apex, then a pelvic surface, then a dorsal surface, then you also expect the lateral margins on the sides, right? So it's also going to have the same description as that of the sacrum. I won't dwell much on it, but clinically there can be something known as coccydynia. Coccydynia is when you have pain in the coccygeal region, right? And that usually develops from trauma, where you have separation of the coccyx from, the sacrum, right? Then this here is going to be the hip bone. You have one on the left and one on the right, right? And they're actually large irregular bones, right? And the pelvic girdle consists of those two hip bones. If you remember the shoulder girdle, which was going to have the scapula and the collarbone, your clavicle, this is going to be the pelvic girdle, right? And each hip bone consists of basically three parts. That's the ilium. This is going to be the ilium, which is going to be the superior part. Then the anterior inferior part is going to be the pubis. Then the posterior inferior part is going to be the ischium, right? And those three parts, they're going to be fused on the outer aspect of this hip bone at the acetabulum in this region, right? Meaning the acetabulum, the superior 2/5 will be made up of the ilium, then the posterior inferior 2/5 will be made up of the ischium, then the anterior inferior 1/5 will be made up of the pubis, right? If you look at the ilium will have an iliac crest, right? So that's going to be the iliac crest. And on its anterior most part, it forms a projection, which is the anterior superior iliac spine. Attachment wise, this anterior superior iliac spine will provide attachment for a ligament. It also provides attachment for a muscle. The ligament is going to be your inguinal ligament, which is going to be the lower upturned margin of the external oblique aponeurosis. Then the muscle is going to be the sartorius, which you're going to see on the anterior thigh, which is going to be the longest muscle in the body. And just below to the anterior superior iliac spine, you find an anterior inferior iliac spine, which is going to be this one. This will provide attachment for a muscle, as well as providing attachment for a ligament again. The ligament will be the iliofemoral ligament, which is going to be one of the ligaments that limit extension at the hip joint. Then the muscle is going to be the straight head of the rectus femoris, which we're going to see forming part of the quadriceps femoris within the anterior thigh as well, right? Then posterior, of course, you find the posterior superior iliac spine, right? And this posterior superior iliac spine lies at the level of S2, right? Then if you look at the hip bone, it's going to have surfaces for this ilium. So this is going to be the iliac fossa, which you remember from your posterior abdominal wall. It is going to provide origin for the iliacus muscle from its upper 2/3, right? Then it's also going to have a gluteal surface, which is going to be the outer surface on the outside, which I'm going to show as well, right? So this is going to be the gluteal surface of the ilium, right? And it provides origin for the muscles of the gluteal region, in particular, the superficial ones, which are going to be the gluteus maximus, the medius, and the minimus, right? They all originate from this surface, right? Then if you look at the pubis, this is going to be the pubis, right? The pubis is the anterior inferior part, like we said, and it's going to the two pubic bones are going to articulate at the symphysis pubis, like we alluded to earlier on, right? And this is going to be the body, right? And on the body, you find the pubic tubercle, Then you find a pubic crest. Right? Then, of course, you have the symphysis pubis. Right? Then you have rami. This is the inferior pubic ramus. That's going to be the superior pubic ramus. Right? And this superior pubic ramus extends from this body of the pubis to the acetabulum, and it lies just above this foramen, which is going to be the obturator foramen. So if you look at the foramen here, the foramen is bounded superiorly by superior pubic ramus, then inferiorly it's bounded by this inferior pubic ramus. Right? So that's going to be the obturator foramen. And in life, it's going to be covered by a membrane, which is known as the obturator membrane. It's going to leave a very small gap on the upper aspect, which is going to be the obturator canal. This obturator canal is going to permit passage of the obturator nerve, the obturator vein, and the obturator artery as they gain access to the medial compartment of the thigh in your lower limb. Right. Then that's the inferior pubic ramus. It actually fuses with the ramus of the ischium, and together they'll be known as the ischiopubic ramus. Right, so you're going to have an ischiopubic ramus, right? Then that's going to be the arcuate line. So this is going to be your arcuate line. So generally you divide the pelvis into a false pelvis, which is basically continuous with the abdominal wall, then the true pelvis. And the boundaries of this of these two, the false pelvis from the true pelvis, you're going to find them at this pelvic brim, which you can also call the pelvic inlet, bounded posteriorly by the first sacral vertebra, laterally by the iliopectineal lines, then anteriorly by the symphysis pubis. The part that lies above this pelvic brim is going to be the false pelvis. Then the part that lies below the pelvic brim and into the canal will actually be the true pelvis, right? Then that's the arcuate line, like I was saying, right? And it's a thick curved ridge, right, which extends from the auricular surface of the ilium all the way to the iliopubic eminence in this region, right? Then you then have the pectineal line here, right? Then the ischium is going to be the posterior inferior part, right? So that's going to be the ischium here. And it consists of a body, and it also has a ramus. And remember I said the ramus of the ischium would join with the inferior pubic ramus to make an ischiopubic ramus, right? Then also on the ischium, you expect to find an ischial tuberosity. Then you also expect to find an ischial spine, right? So that's the ischial spine, that's the ischial tuberosity. These are going to provide attachment for quite a lot of muscles within the pelvic region, right? The ischial spine and the ischial tuberosity. The spine projects posteromedially, right? And it separates the greater sciatic notch from the lesser sciatic notch. Those notches are going to be converted by ligaments into a greater sciatic foramen and a lesser sciatic foramen, right? So those are going to be like the parts that you find within the pelvis. And like I said earlier on, you're going to have a false pelvis than the true pelvis. The boundaries of the false pelvis, posteriorly you find the lower lumbar vertebra, then anteriorly you find the anterior abdominal wall, then laterally you have these iliac fossas, right? That's going to be the false pelvis, which you can also call the greater pelvis. Then the lesser pelvis is the canal inside there, which is going to be the true pelvis, right? So that's going to be your true pelvis, right? Or the false pelvis, or the lesser pelvis rather, right? Then let's do the same. This is just a femoral specimen. And if you look at the subpubic angle, The subpubic angle is going to be more in females. It's going to be about 80 to 85 degrees as compared to males, where you find a subpubic angle of about 50 to 60 degrees. Right. These are just disarticulated bones now, where you can see the iliac fossa here. We can appreciate the iliac crest there. We can appreciate the sacral canal there. That's the greater sciatic notch. Then that's the posterior medial projection, your ischial spine. That's the lesser sciatic notch. That's the coccyx. That's the sacrum. Right. Then from this view, it's still the same. That's the pubic symphysis. That's the pubic tubercle. That's the pubic crest. So notice the crest is medial to your pubic tubercle. Right. So that's just about it. Thank you.